Hi, here I am a Friday afternoon in the Dáil. Contrary to a lot of opinion makers in the media, we are still working very, very busily away. There's a message sent out there yesterday that all of a sudden we're gone away for 3 months. That is totally untrue. I've had a very busy morning working on the estimates, working on services for disabilities right around the country. So it's important, I think, that the public know that the work goes on even though when the Dáil is closed down. Another important issue was on Thursday in the Dáil. I had a fantastic day. I brought the Health General Practitioners Bill through the Houses, which essentially granted 14,000 free GP cards to carers in this country. Basically, it's a message from myself and from my colleagues, the other ministers, to say that we care about carers and they're entitled to a free GP card. 14,000 people will get this on the 1st of September. And again, this is another small part, a step in the right direction in supporting people with disabilities.
In relation to this particular piece of legislation, this is a step. It's a step for the 14,000 carers, and it's saying, listen, we appreciate the work we've done, and this is why we have we're granting this free GP service. Do we need to do more? Absolutely. Am I listening to the suggestion put forward by colleagues? Absolutely. But I will ask everyone one favour. When it comes down to the crunch over the next few weeks in the debates about the estimates, and we have already had our first meeting, I'm going in putting services, I'm putting residential, I'm putting carers, I'm putting people with disabilities at the top of my list in relation to public spending. There will be other people arguing that we need more tax cuts. There will be other people arguing for other issues. What I'm saying is I need the support of all members of this House, regardless of party or being an independent or party. If everybody rallies around the carers, we can get more in this budget for the carers, because I totally value the magnificent work that they do. Thank you.
Earlier this week, I met the National Platform for Advocates for People with Disabilities, and they were involved in discussions with me in relation to the estimates and the budget. They brought up very invaluable things to me in relation to housing, personal assistance hours, residential services, and also independent living for people with disabilities.
I think that the people that have a disability shouldn't live 8 miles away from the community. I think if they want independent living, they should live in the community where they can go on the bank, go to the doctor, get their tablets and live independently without their parents or their sisters, or living in community houses. Community houses are okay, you're self-provider, does give you some, but you want really independent living.
We're dealing with very serious issues as well in relation to Brexit, in relation to housing, and also in relation to the health service generally. So the work goes on regardless, and regardless of what people think, people are very busy around the House, ministers are very busy at the desk, and that's the way politics is.